Okay, do we have everybody here? I'm looking at my list. I see Tori, I see Krista, I see Dr. Kirk. Good morning. And Dr. Giesel. If I'm going to use doctor as a prefix, I need to be even about that. So I may call him Dr. Mullins is here. I'll get it right one of these days. And let's see, is anybody else back here that I haven't seen yet? I see Jeannie, Dr. Siebold is here. And Linda is here as well, and Bill's here. Okay, I think we're all here. We do have a quorum. In fact, we've got good representation of the board. Do we need an official roll call here, Suzuho, or was that good enough?
I think we're good. Thanks, Greg.
We got it. Okay. I wanted to discuss the agenda briefly. I know we've got round robin added in the last few minutes. Now, I think this is going to be a very short round robin because I know the Board of Public Health staff has work to do as soon as we hang up. But we're going to try and do a little bit. If somebody has something on their mind they want to add, just to call our attention to, that's our chance to do it, and that will be after the exec session. So we'll be coming back from an executive session to have our meeting. Excuse me just a second. Okay, now I'm back. Okay, so I think I need a motion for approval of the previous minutes unless we have corrections to discuss. Is that a motion, Dr. Kurt? And then second by Krista. Okay, all in favor, raise your right hand. And I have approval on that. I'm going to go, I don't see Linda, but I know she's here. And Bill, I didn't see your hand, but I'm going to assume that's approval. Thank you. Okay. Switching back and forth and all this. Okay, so we have approval of the agenda. Next is a COVID update, and that's going to be Josh and Carly.
Thanks, Greg. Hope you can all hear me okay on my phone.
We've got you. You're a little quiet. If you can, get closer to the microphone, maybe that'll help.
Yeah, can you hear me better?
I can. I think that should. I'm remote, so I think everybody should be able to now. Thanks.
Perfect. So wanted to start off by just sort of giving an update on where things are globally with COVID. I think for a while here, things really did seem to slow down, not just here locally and not just across the U.S., but really there was sort of a slowing down of cases across the world, although some countries continue to see increases. But over the past month or so, many countries have begun to see increases in cases again. You can see over on the right-hand side, I just selected a few countries. There are a lot of countries that are not spiking. They're just plateauing or not really seeing a lot of movement. But here you can see that there are many countries, especially some pretty large countries, that are seeing some pretty significant increases in cases. And so it really just calls attention to, where we are right now in the pandemic and that the pandemic is not over and that we are still seeing impacts and many people impacted by this virus around the world. Next slide, please. So then this is the same countries from the last slide. This is their vaccination rates. So you can see that a lot of countries are doing fairly well when it comes to their vaccination rate. Malta, UAE, and Israel are the top three when it comes to the overall share of the population who have received at least one dose of the vaccine. But some of these countries, they are seeing increases in cases, and it's mainly in unvaccinated pockets of their population. So while breakthrough cases are existing in some countries, in all countries to some extent, it's really unvaccinated pockets that are really contributing to the increased spread of the virus. So you see these countries here with higher vaccination rates. Doesn't necessarily, even if they're seeing an increase in cases, doesn't necessarily mean that it's the fault of the vaccine or vaccine efficacy being lower. It's really these unvaccinated pockets that are contributing to a lot of the spread. Next slide. So did want to highlight the UK as I have in the last couple of meetings, just because our numbers do tend to lag the UK by usually about 3 weeks or so. So this on the left-hand side is the number of cases that the UK has reported per day over the course of the pandemic. But if you look on the right-hand side, you can see that they're really starting to increase and have been increasing since the beginning of June. They're reporting close to 40,000 cases per day on average now. And some experts in the UK are predicting that they'll actually potentially get to the peak of where they were back in January. So, they will continue to see quite a bit of an increase in cases there. If you look on the right-hand side, that's the new reported deaths by day. And so, earlier on in the pandemic, there was a pretty close correlation when it came to deaths following cases that were being reported in the UK. But you can really, here in this picture, see the impact of vaccination when it comes to deaths being reported following cases. On December 22nd, when the UK was seeing a surge, they were averaging about 34,000 cases on that day, and they had about 500 people dying each day right around that time period. On July 12th, they're reporting right around the same number of cases, about 34,000 cases per day, but they're only reporting about 30 people dying each day. So there's a significant decrease in severe illness that's being attributed to COVID, which is very much so in large part due to vaccination. Of course, we've gotten better at treating COVID when patients are ill, but really this is a function of vaccination. Next slide. And then this is the U.S. I just wanted to, take the same graphs we looked at with the UK and now look at the U.S. This is cases and hospitalizations are on the right-hand side. You can see that we have much more of a correlation. So whereas the UK was seeing a much lower number or proportion of deaths per each case, our hospitalizations are starting to trend, in suit following cases. So, it's while we tend to really track behind the UK, we are seeing a bit of a difference here when it comes to hospitalizations. And then on the next slide is on the right-hand side, you'll see the deaths in the U.S. being reported per day. You can go to the next slide. Yeah, there we go. So you can see that, with the UK graph, we weren't really seeing, it was harder to see that increase in deaths, whereas here in the U.S., it's a little bit more apparent. Our case fatality rate right now is still pretty close to what it was in late winter, hovering around 1 to 1.5% among known cases, right? So there might be a lot more people who are not being tested, and so we don't have record of those individuals being cases. But regardless, our case fatality rate is still higher than the UK's. And it really just, again, echoes the importance of complete vaccination. So getting, the full 2 doses of Pfizer or Mrna, or getting the Johnson & Johnson vaccine 1 dose. But the UK has 69% of their population have at least 1 dose, compared to 56% in the US. So, there's definitely a difference there, and it does appear to have somewhat of an impact. Although a lot of the counties in the US right now that are experiencing these surges and are contributing to the increased number of cases tend to be counties that have lower vaccination rates, and they're just seeing this Delta variant really spread and surge in those counties. Next slide. So some info on the Delta variant, since this has been really a hot topic, and the Delta variant has recently become the most predominant variant in the country. So as I mentioned earlier, Malta, UAE, and Israel have the world's highest complete vaccination rate, but they are experiencing increases in cases, as I showed a few slides ago. And again, this is particularly among unvaccinated pockets of the population, but they are reporting that some breakthrough cases among fully vaccinated individuals are helping to accelerate some of that spread. As I mentioned, CDC reported yesterday that 58% of all new cases that were sequenced recently have been the Delta variant. So the Delta variant has now overtaken the Alpha or the variant out of the UK as the most predominant variant in the country at this point. There's a study that came out recently out of the UK. They did find the Delta variant to likely be 50% more transmissible than the Alpha variant. Again, alpha variant is B117, the variant out of the UK. And another study, or several studies actually prior to that, found that the alpha variant was 50% more transmissible than the original Wuhan strain or the wild type virus. So, really the Delta variant is almost doubly transmissible as it pertains to the original Wuhan strain that was circulating back in early 2020. And so over on the right-hand side, this is out of Australia. They posted this graphic here, which really shows the how transmissible the Delta variant is compared to the original Wuhan strain. So you can see, according to Australian data, original Wuhan strain, for every 1 case, you were infecting about 2.5 other individuals on average, whereas with the Delta variant, they're seeing, at least in Australia, 5 to 8. Australia has a much lower vaccination rate than the US, so there's not a lot of insulation, so it can spread a lot more easily among the population. So we wouldn't really see it spread 5 to 8 different people because we have a lot of individuals who are vaccinated around the country. But regardless, it is still much more transmissible than the original Wuhan strain. And then, the risk continues to remain for individuals who are not completely vaccinated. So that really is where the highest risk remains with the Delta variant, as it has with the other variants. But then there are some individuals who have immunocompromising conditions who are fully vaccinated or have been fully vaccinated, who might be at higher risk for severe illness compared to those who don't have immunocompromising conditions. So there is some data out there to show that certain individuals with certain conditions may still be at fairly high risk, even if they were fully vaccinated. But that risk is very low compared to those who are not vaccinated. Next slide. And then just wanted to touch on this study. This is a very small study that just recently came out looking at the efficacy of mRNA vaccines against the Delta variant. And just in summary, what they found was that the mRNA vaccines are still very highly effective against the Delta variant. So in this study, they looked at 10 individuals that had received the Pfizer vaccine and 15 that had received the Mrna vaccine, and they compared their neutralizing antibody activity with the Wuhan strain compared to the Delta variant. On the right-hand side in that red box is Delta variant. And they found that, while there was somewhat of a decrease in total antibodies, it's still above the threshold that offers significant protection. So, as it pertains to immunity from vaccination, there is still significant immunity from being completely vaccinated with Moderna, Pfizer. They didn't assess Johnson & Johnson, but we know that Johnson & Johnson is still offering significant protection as well. On the left-hand side, just for your awareness, the one that's not in the red box, that's another variant that's similar to the Delta variant, but it really hasn't taken off as quickly as the Delta variant has. But the results are pretty similar for that variant as well. Next slide. So this is we're moving more locally now. So this is the proportion of all specimens that have been sequenced in the state of Colorado and what they have found in terms of variants. So you can see in that lavender ink color, that is the Delta variant. The blue color is the Alpha variant. And you can see that the Delta variant has really overtaken the Alpha variant, which is what we expected to happen. We saw this happening in India several months ago, where the Delta variant had completely overtaken the Alpha variant. And so we were expecting this to happen eventually, and it really has. And then on the right-hand side is just a few different select counties and how many cases of Delta they are reporting each. So you can see Mesa County, which has been in the news a lot recently since they have reported so many Delta variant cases. They have exactly 600 when this is pulled. Garfield has 85, and then you can see there's sort of a smattering of other reports in different counties. We have only reported 4 Delta variant cases, and only 2 of those were in Pickton County residents, 2 were visitors. So really the proportion is it's just very different from when we compare it to other counties. We just haven't seen a lot of Delta variant activity to this point. Next slide. And so this is kind of taking our data and looking at all of the variants that we've sequenced among Pickton County residents since January. And you can see that the vast majority of our variant cases have been Alpha variant cases. The variant of interest cases in the green. Those are really mainly Epsilon, which is the variant out of California. We did see quite a bit of an increase in those variants back in March and April, but haven't reported any of those since late April. And then we've had, as I mentioned, 4 Delta variant cases and then 1 Gamma, which is the P1 variant that caused the surge in Brazil. But really, we have several weeks where we didn't really, we had some individuals who were testing on antigen tests, and so those weren't being sent into the state lab for sequencing. But we also had a long period of time where we really weren't, we had such low case counts that we didn't really have much to sequence. So that's why you're seeing that white space there on the right-hand side. Next slide. And then this is just variance by age in case anyone was interested. So, it sort of mimics what our normal cases look like, where you see sort of an increase in the 19 to 30-year-old population, a little bit in the 31 to 50-year-old, and it just kind of falls off. So pretty similar to what our case counts look like among non-variant cases. So there doesn't appear to really be one age group that is more impacted by variants than others. Next slide. So then this is our recent case count and our positivity rate on the right-hand side. And it includes our breakthrough cases as well, which I'll talk about in a second. And so, we've, been averaging about 2 cases per day on average in the past month. So just a lot lower from where we were back in December and January. We are getting some cases reported to us here and there. We're not seeing large outbreaks. We currently have 0 outbreaks right now that we're working on. So a lot of these cases are solitary, and they're just, they're not really connected to many other cases that we're aware of, at least not within the county. But you can see our our positivity rate has increased over the past week or so following 4th of July, which isn't unexpected. We knew or had an idea that our positivity rate and case count might increase a bit after the 4th of July, but it does appear that our positivity rate might be coming down a bit over the last 2 days. Next slide. But wanted to show, when you look at that one graph of just looking at the past 4 weeks, doesn't really paint the whole picture. So when you look at the entire picture from the beginning of the pandemic, to see where we were and now where we are, there's really no comparison. Back in early January, we were averaging 51.7 cases per day, whereas now we're averaging 1.7 cases per day. So while it still feels busy at times, still feels like there's plenty of COVID activity compared to where we were, it's very different. Next slide. So then, like I said, I wanted to share some data on breakthrough cases and then talk through that a little bit since it has been in the news a lot, and just wanted to add some clarity around breakthrough cases. So CDC defines a complete breakthrough case as somebody testing positive for COVID in the last, at least 14 days after they had received their final dose in the vaccine series. So 14 days after your second Mrna or Pfizer dose, or 14 days after your Johnson & Johnson single dose. And then a partial breakthrough case is really just someone who only received 1 dose and then 14 days later or more tested positive for COVID, a partial breakthrough. And so we know that, as long as the vaccine is not 100% effective, some individuals who are fully vaccinated or partially vaccinated will still become infected. That's been a historic trend throughout many pandemics, throughout many disease processes. With all vaccine-preventable disease, we do see some breakthroughs. The idea, though, is that you're going to see less severe illness among those individuals, and that the vaccine will provide protection against severity. In late June, CDC did report that there was over 4,000 hospitalizations and deaths among fully vaccinated people. But if you divide that over the well over 140 million individuals that have been vaccinated, that number is extremely small. I estimate to be right around 0.003% of all vaccinated individuals. So very small percentage of individuals who are being hospitalized or had died after having been fully vaccinated. Next slide. So this slide here looks at the risk of infection by vaccination status here in Pickens County. So the red is the proportion of individuals who tested positive divided by the number of individuals who are not vaccinated. And so you can see the proportion there gets pretty high in March and April. But when you compare that to the gold line, which is the proportion of individuals who are tested positive who were vaccinated, there is a very large gap. You'll see that the gap is, it's starting to narrow a little bit, which is expected since we have 75% of our population estimated to be vaccinated approximately. And so we expect that we're going to get some breakthrough cases. And so we know that that gap is going to narrow a bit. However, even with so many people vaccinated and a smaller proportion of the population who are not vaccinated, the risk of infection when you are unvaccinated compared to when you are vaccinated is still 3 times greater. So, we back at in March and April there, the difference between being vaccinated and unvaccinated there was about a 96 times difference there. You were 96 times more likely to be infected if you were unvaccinated versus vaccinated. That's, obviously gotten a lot smaller. However, 3 times is still a very large risk there for individuals who are not vaccinated at this time. Next slide, please. And then this is just total breakthrough cases by age. We've seen sort of breakthrough cases across all age groups, but really on the right-hand side is probably the most important piece here, which is taking the total number of breakthrough cases we've had by age group and dividing that by the proportion of that age group that's vaccinated. You'll see that's a very, very, very small number. Far less than 1% of individuals who are vaccinated are testing positive. But again, the good news here is that even though we've had some positive cases among breakthrough cases, we've had 0 overnight hospital admissions among breakthrough cases and 0 deaths. So vaccine is working extremely well. It's protecting against that severe illness, just as we expected it to. And next slide. And last slide for me is just a few things that are sort of circulating and sort of newsworthy. So the WHO did about 3 weeks ago urge everyone around the world to continue wearing masks. The National Nurses Union, which is the largest nursing union in the country, pressed the CDC this week to reinstate universal masking as well. So just a lot of coverage around masking at this point, and a lot of concern over what the fall might look like and what that might mean moving forward. And then just 2 other notes I wanted to mention here. So in the majority of cases here in Pickens County, when a COVID-19 case has been insulated by vaccinated persons, we really don't see any spread. With so many individuals in our community vaccinated, when we do get a case, we're not really seeing those transmission chains that we had seen several months ago. Again, more evidence that we know the vaccine is working and it's protecting individuals who are not vaccinated or individuals who not yet had the chance to be vaccinated. And then we've had a few instances of vaccinated individuals infecting other vaccinated individuals, although this is it's pretty rare at this point, and it does tend to require a prolonged exposure for the most part. So spending a very long period of time with that individual in order for them to ultimately test positive. And then lastly, as I'll transition into or pass this on to Carly, vaccinations, particularly the FDA approved ones here in the US, continue, as I've mentioned several times throughout the presentation, to be highly protective against severe illness, hospitalization, death, and also protective against long-haul COVID symptoms. So with that, I think I'll pass it on to Carly, and then I think at the end we can answer any questions.
Awesome. Thank you, Josh, for teeing all that up. So a very brief update on kind of where the vaccination process is and sort of what the strategy is focusing on and where we tend to look towards moving in the direction of. Just based on the data from the state's count, which is on the right-hand side, we are at 85.9% of the eligible population, so our 12-year-olds plus, who have received at least a single dose. And then by the county's count, which we include our entire census population, we are at 79% of the population having access to at least 1 dose of the vaccine. The reason that we tend to measure by 1 dose is integration with other states and maybe people got vaccinated elsewhere. So 1 dose is sort of the measure that everyone's using to kind of generate those percentages. Functionally, we are incredibly high. Quick thank you to everyone who's been involved, both the Board of Health members, public health, all of the partners. It has certainly been an effort and a monumental effort to get to the space that we're in now. But I'm very proud of everyone here, as well as our entire community, for engaging in the vaccination process and efforts up until this point. We are continuing to identify barriers to the vaccination process. We know that there is still pockets of our community who haven't been able to prioritize or access vaccinations due to various reasons, not just not just vaccine hesitancy. A big one that's been identified is work hours or childcare, as well as transportation. And then of course there is the misinformation or hesitancy or vaccine watchers. And so a big push that we've had through the summer and what we continue to work towards is lowering those barriers by offering off-hours clinics through August, really pushing to make sure that we are giving everyone the best possible opportunity to receive a vaccine. And I'll talk a little bit more about that on the next slide. But the big future push and kind of looking at fall and sort of what the long-term efforts in regards to COVID-19 vaccination are going to be is working really closely with our primary care providers in order to bring more online as vaccine administrators. A really big transition with that is that we no longer see these thousands or hundreds of people looking to get a vaccine in one day, but really wanting to have those conversations with their providers. And so that's the perfect opportunity to bring those individuals who have played a wonderful support role in the clinics up to date and kind of pushing the focus more into that direction while public health sort of takes on more of a support role. And so that we'll talk a little bit more about that on the next slide. Next. So we currently are working on 2 forms of clinics, both focusing on our major population hubs. The Snowmass mobile clinic, which has been operated in partnership with public health and community health services. We just had our second dose, our second clinic up there last week, and it was incredibly successful. We've had well over 100 people each clinic between Pfizer and Johnson & Johnson. And so we are still seeing uptake of Johnson & Johnson, particularly for those individuals who might be hesitant to engage with the vaccine efforts in it. And so last week, about 50% of all of the vaccines administered were first doses. So we are still seeing spaces and opportunity to vaccinate individuals who want it and just haven't been able to access it. We also this week had 2 days of the CDPHE vaccination mobile bus coming into actually Ruby Park, which was really fun to see. They were relatively busy, but I do think that lunch hour right there is a little difficult to target some of those working populations just based on how busy a lot of those workplaces are currently. That being said, they did identify that a lot of the efforts being made to drive people to the bus were really successful. They identified a few, which I'll talk about a little bit more in the comms update. But it was really exciting to see them here. And then going forward, we're really hoping to leverage that visibility of not just the location, but kind of the generated energy surrounding the vaccination bus into central downtown Aspen vaccination clinics. Again, a big focus on the next couple between Snowmass and Aspen is going to be those off hours, whether that's early morning, later in the afternoon, potential weekends. We're still trying to strategize about what is the best way to target those individuals who haven't gotten the vaccines yet. And again, just looking to the future, looking to the fall, Josh briefly brought up the idea of potential boosters and kind of the ongoing changes in the FDA and approval process for some of the vaccines is Mrna and Pfizer have both put in for full FDA approval. We are waiting to hear on dates for when those hearings are going to take place, but we also know that they are very interested in approving all school-age children for vaccine under the EUA. And so as that landscape shifts on who's going to be eligible for vaccine coming up, it is going to be a lot of those younger children. Potential for boosters is likely going to be individuals with certain conditions that would make them eligible. And most of those conditions revolve around immunologically reduced conditions. So our elderly, our cancer patients, various other illnesses that could impact the effectiveness of the 2-dose or single-dose regimen for an individual. For those demographics, particularly those young children and those individuals with those conditions, having those conversations in a clinical setting with their primary care provider is really going to be the most impactful and most effective route. And so really working with those providers in order to create that space for this upcoming demographic shift is really, really important. Where this would put public health and kind of the effort that we've made with our clinics is really focusing on any large pocket that either becomes eligible or that is incoming who might not have been vaccinated. So a big push is going to be potentially those school-age children, incoming winter staff when we look kind of in that late fall area, and then really focusing on providing support roles for pop-up and mobile clinics for our at-risk and marginalized communities and populations, and really making sure that those individuals who are continuing to experience those barriers get the attention and the space that they need in order to access the vaccine to maintain and improve those vaccination rates that we see that are so high right now, but we know that we're going to have moving targets as more approvals come through. So again, come the fall, we are running our mobile vaccine pop-up clinics through the summer, through August for right now, and then really working on those providers to come online as vaccine administrators. So next. And I think that brings us to some of our hesitancy in communications. This last month or so, the public health comms team has really kind of taken the baton and found some really cool, fun, interesting ways to garner engagement. One of the big ones has been that use of our street team. And so this is actually people on the ground from public health armed with information about scheduling and about the kind of entire vaccination process in order to generate interest or knowledge about upcoming vaccination clinics. The really big call to action there is there's a clinic coming to your neighborhood. Please sign up, walk-ins welcome. Tag teamed with that is there's been a lot of effort for our vaccine bike to come online. You can see myself playing a fool riding the vaccine bike around at our last Snowmass clinic. It was really cool to see it. It really did garner quite a bit of interest. People wanting to take pictures with it, people wanting to ask questions about it. Our street team manned that during the Snowmass concert series, which was really exciting to see. And so really targeting that younger demographic, that 18 to 30-year-old who's going to those social events and trying to encourage them to sign up for those vaccinations. That QR code that you see on the front of it also directly links to the public health scheduler, which is really exciting. So even if it's not explicitly manned, it still has that scheduling information available. The other effort that was really made that we're excited to see how far it spreads is we worked with Father Burt down in Glenwood Springs in order to actually bless the vaccines in English and in Spanish. And the big push for this is not inherently a call to action about a specific up and coming clinic, but it really is the target of focusing and working with our community leaders in order to show support for the vaccination effort, particularly if it can be identified at a particular demographic. And so we know that some of our faith, there is some faith-based hesitancy, and so working with the Catholic Church to show that the Catholic Church approves and encourages members to go get vaccinated, and both in that Spanish and English to hit all kind of fronts on that. And so that was really cool to see. You can see the video there if you'd like to. And so, yeah, kind of taking some of these feedbacks that we're getting about hesitancy, about barriers, and really trying to figure out fun and engaging ways to get people to engage with the vaccination process and with the clinics. This is just sort of the beginning. I foresee many, many more fun activities and kind of creative ways of addressing some of these fears and anxieties going forward as well. And I think that wraps up my vaccination update. I think I'm going to pass it off to Larissa for general comms.
Okay, Larissa, thanks.
Thanks, Carly. Just one more slide and just a quick additional update to some of the work that the communications team has been spearheading. And the first one is a healthy best practices video that you should be seeing at the Aspen Airport soon, if not already. And this one replaces our former 5 commitments to containment video that was a little outdated. So we'll have that video showing at the airport. The second is we partnered with the Town of Snowmass Village Recreation Center to create an educational video as well as slightly humorous video with to share with camp counselors, for parents, for kids that are all engaged in summer camp this season. And there are some adorable responses that are non-scripted from some kids that attend the camp. So feel free to check out that video if you have a chance. It's pretty awesome. And so continuing to push the healthy best practices and prevention measures, and continuing to work with the communications team to keep coming up with those innovative and creative ideas to get some of the messaging out. And so that is the end of the slide deck, Greg. So I will hand it back to you.
Great, thank you. And just I want to make sure we can access those links if anybody wants to look at them or repost them or anything for those videos. But that's great, and I can testify that VaxBike does draw a lot of attention, and people were enthusiastic about it. And I saw it up in Snowmass. So well done on that, and well done to your team for digging that thing out and turning it into from a popsicle bike to a VaxBike. It's really, it just lightens things up, and it draws people in. Okay, we're right on schedule here. We have an executive session planned, and we
Ask a couple of questions real fast. Sorry.
Oh, sure. Go ahead, Krista.
Quick question for Carly and a quick question for Josh. Carly, just to clarify, it sounded like you're going to try to move the vaccinations more to the primary care based model. However, if there are, like, for example, if we get approved for 12 and under, there are opportunities for mass vaccination clinics, because that would be such a large group that would need vaccinated all of a sudden.
Absolutely. We're looking at the provider focus for that, really that long term, right? We know that this is not just through December, but absolutely that look, when we can identify those pockets that really do need that support and would overwhelm the providers that are online, I really support and would love public health continuing to play that role.
Right. I just think that's really important, because we want to get people as vaccinated as quickly as possible. So thank you. Thank you for that.
100%. Thank you.
Great. So we'll mobilize when the time comes. If it's necessary, we can mobilize. We've already have experience doing that and large scale, I assume maybe at the schools or with large groups. Yeah, thank you. Thanks for the question, Krista. Any other questions before?
One more for Josh. And my question for Josh had to do with that FedEx outbreak. If we have any information about what variant that was or anything else surrounding that down in Garfield County.
Good question. I don't remember what it was. I believe it was Delta variant, but I can't say that with confidence.
Thank you.
Okay, great. Thank you. I need to, what we want to do at this point is go into an executive session for the purposes of recruitment and hiring process for public health director, discussion with council pursuant to CRS 246402-4B, and performance evaluation of interim public health director pursuant to CRS 246402-4F. And what I need is a motion to go into exec in a second, and then we'll vote, and then we'll meet at the next Zoom link. I had a motion, Krista?
Move to executive session.
Okay, I've got a motion from Krista and a second from Dr. Kurt. All in favor, raise your hand, and I will take a quick gander here to make sure everybody's got their hand up. Yes, they do. All right. Thank you. All in favor, that's a yes. And so we're going to meet again in the exec link, and we'll be looking for you in a couple of minutes over there. And then keep this link, because you know we're going to come back to this after we're done there. So thank you very much. See you in exec.
Hey, Lindsay, it's Zuho. I saw Linda had her hand up in the attendees section. Can you just double check that she got a link to go over to the executive session too, please?
Yes, I'll check that right now.
Awesome, thank you.
Mrs. Zuho, this is Kim.
Hey, Kim.
How are you?
Good, how are you?
Good, thanks. Yeah, I'm just gonna hang out here so that when they come back, I'll just keep it open.
Yeah, me too.
Yeah, I know I didn't want to be part of the whole HR issues.
Yeah, no.
So
Okay.
I just don't know how much time they'd be back. So if that's cool.
Yeah. Totally. Yeah, no, I think I think participants can still hear us, but anyone's welcome to stay on just to
Great.
be prompted when they're coming back.
Thanks, Azuko.
Yeah, thanks.
right, we're recording. We've got the team is mostly back. Bill, Tori, Jeannie, Krista, and me, Jordana. Dr. Kurt's not here yet, but he will be shortly, I think. Marky's here. Did I see Linda? Not yet. Okay, there's Bill. Okay, let's see, now is everyone else here? Are John and Phyllis and John, if he's here, Melissa, Linda's here. Here's Linda. Okay, I see you all popping in. Great. All right, so we've just completed our executive session with the board to discuss personnel, recruitment, hiring. And having done that, I'd like to just keep us moving. And if it'll give us a little bit more time for any other round robin that we want to bring in. And so I'd be looking for a motion from a board member regarding appointing a new director. Dr. Kurt?
I move we proceed and authorize John Peacock to hire Jordana as our permanent director and do the proper negotiations.
I'll second that.
Thank you. I've got a second from Jeannie. Any other discussion on that? Seeing none, I'm going to call the question. All in favor, raise your right hand. And Suzuho, I hope you're there and you're taking, but I think we have a consent here. Marky, are you at consent? I just want to make sure I see a hand up, or if you want to, okay, just want to make sure Linda's hand's up. All right, thank you. Okay, so we've directed our county manager, who's in charge of hiring, to appoint Jordana, to hire her and offer her the director post of the public health department. And I see Jordana has joined us. And so I want to say thank you and be the first to congratulate you. I think congratulations are in order. This is like congratulating you for the toughest job in town. So thank you, Jordana. And that we know that it's been a rough year and a half, but you've clearly have everyone's confidence, and to have a consensus vote on this is important to all of us. And I think we're all in agreement. Is there any other discussion? If anybody else would like to say anything briefly before we go into round robin, or we can begin the round robin now. It seems like kind of such a quick end to that whole conversation, but anyway, it was certainly one of we all took very seriously, and I think we're all grateful for the outcome. John Peacock, I might just ask you if you can hear me. Is there anything else we need to conduct regarding appointment of Jordana? If you could describe perhaps the process very quickly, what you're going to be doing next, just for public at large, if anybody's listening, that would be helpful.
Yeah, thanks, Greg. I think we had some difficulty with our link here, so I caught half of that, but I think the question was next steps. And so we did catch, I believe that the board has given direction that they would like to appoint Jordana to the public health director position. Jordana, thank you, congratulations and condolences all at the same time. Now we appreciate that. And so now the county has a process that we go through to finalize any negotiations. Jordana would be coming in under the county's personnel policies. And so we have started some of those conversations with Jordana, and I think we will conclude those as quickly as possible so that we can remove the interim from Jordana's name. And so I'd anticipate that would probably come at this point, probably early next week with this direction.
Great.
And we do intend to put out a press release given this direction from the board.
Great. Thanks, John, and thanks, Phyllis, for your work on the background on that. We see you there and we appreciate you as well. Okay, I'm going to keep us moving here. We've got a little bit of time. We could have a round robin. I remember we initiated this at the beginning of our Board of Health meetings, because sometimes ideas take a while to distill, and occasionally it's a good thing for people just to speak their mind. We've got a little bit of time, so if anybody would like to bring anything up, I see hands up. Krista was first, and then Dr. Kurt.
I just wanted to bring something else up that was actually kind of non-COVID related. This is one thing I actually do at the VA, which is a lot of narcotics work in terms of narcotics reduction. And an article came out this morning about a 20% increase in overdose deaths from narcotic use. This is primarily things laced with fentanyl, which we are not really seeing in our valley yet. But unfortunately, once this starts other places, it usually trickles to all aspects of the country. I think one biggest thing that, just as a public health concern, and maybe more of a question that I have right now, is kind of how we have naloxone kits available. Again, this is one thing through the VA. We're really good about getting in everybody's pile we possibly can. And just in terms of access to naloxone at local pharmacies, local providers, I think that this is just something that we should probably, as a Board of Health, put kind of on front and center that's non-COVID related.
And Greg, if I could just add, we can include that in our update when we give a mental health update, the work that's being done with naloxone with PAC program.
Fantastic, that's great. I had Dr. Kurt, and I wasn't sure if Kim had her hand up or not, but Dr. Kurt next. You're muted, Tom.
I'd like to clarify, based upon the data that Josh Vance presented, that we're not having any changes in our current public health orders based upon what he presented going forth for this meeting. Unless Jordana anticipates, I could ask that, but it's my understanding or feeling, looking at Josh's data, that we are not necessarily issuing any different public health orders at the present time. And I also, with background in medical toxicology, have noticed that in the past year, there's been a 29% increase in overdose deaths, largely due to fentanyl that comes in from China and Mexico. And in fact, at the present time, I'm reviewing a manuscript for a medical journal exactly on this topic. So it's of tantamount importance locally as well.
Thank you, Dr. Kurt. Dr. Levin, did you have your hand up?
I just want to say I appreciate Dr. Geiser bringing and Dr. Kurt bringing up the issue of opioids and the work that we did pre-COVID, which is refreshing to go to on a different topic, that there are standing orders for naloxone in all the pharmacies, and the ED now is giving out naloxone as well, has set that up. So we have some work done and more to do in terms of getting the word out and saving lives in that. So just wanted to mention it. Thank you.
Great, thank you. If I don't see any other hands up, and if you have something, raise your hand. Meanwhile, I was going to throw out, we talked about the Vax Bike, which I think is the coolest innovation to come along to raise awareness for vaccines. If you have a chance to go out and work with it, I was going to recommend that if there was a chance to park it at the Saturday market, if there's an opportunity to do that with the Aspen Saturday market, that might be just anywhere out on the street. It really seems to draw some attention. We had the national news this week that Pitkin County was, I think, among, John Peacock would have the answer, or maybe Jordana would. I think Pitkin County was among the 20 highest, healthiest communities in the nation, and we had the absolute lowest COVID mortality rate. And I'm not sure quite how to process. I know it's something we can congratulate Jordana and her staff and the whole county staff for.
And Dr. Levin.
Responded. And Dr. Levin, yes, she's part of this team. But also, it's like, how do we, it's like, as John pointed out earlier in our BOCC meeting, it's not something we want to brag about so much, but it's a milestone I think we need to acknowledge. And in difficult times, to come out fairly well relative. It's such a good thing. So can you share with the details on that with us?
Jordana, do you want to do it or do you want me to?
Do you, I was wondering if you wanted me to send him to the board, Greg, or do you, yeah, I'm happy to, or John,
Yeah,
do you
why
want
don't you send that to the board? Basically, Aetna, along with US News and World Report, ranked the 25 healthiest counties in the nation. We're number 7 or 8 on that list. I'm trying to remember. You'll see it on Jordana's. And then they calculated the COVID death rates by population for those 25 healthiest counties. And Pickens County, by far, I would note, had the lowest death rate of the 25 healthiest counties in the nation from COVID. And as Greg said, I think it really speaks volumes about the work that you all did. It speaks volumes about the work that our public health staff did. It also speaks volumes about the work that was done to support the community through the pandemic and all the disruptions that the pandemic had, whether that be in emergency housing, emergency food assistance, emergency cash assistance. And we really saw both public and private sector partners step up to support our community doing the right thing. And while we did have some high incidence rates, we did a very good job of protecting our vulnerable populations. And it's not just because we were healthier, some people would say, when you compare us against the healthiest, we were the best at that. And so I guess I'm bragging a little bit now, Greg, on you all and the organization, which I said we shouldn't do, but we should celebrate that.
You know, John, when I first saw that when Aetna sent it to me, it looked almost like an advertisement to buy one of those plaques whenever you get in the newspaper or something. And so I half discounted it, but I'm glad that that you all read it more deeply and took it seriously. And so I'm going to encourage us to celebrate that at the appropriate level, and I think it should be included in a press release. You know, it's just part of the documentation of this entire interesting, long, strange trip we've all just been on and are still in to some extent. And I think if we released information about that about the same time we announce that we're codifying Jordana's position as our director, I think that wouldn't bother me at all. But I'm going to leave that all to you. I had another thing that came up when I had a chance to chat very briefly with Jill Ryan, who at State, who was very supportive of Jordana's inclusion or being made the director because they've worked together. And so she was very supportive of that. And so it's good to know that as well. But the reason I'd called her is because I was concerned that I keep hearing about fake vaccination ID cards. It seems that the fake vaccination card is actually a thing here. And it defies logic for me, but people do it because they think it's a way around an inconvenient situation, I guess. And the response I had when I mentioned it to Jill is that there's really not much a business can do. They can demand an employee be vaccinated, is that right? But if somebody provides a fake vax card as proof, they really can't look into it because I guess there are HIPAA laws that would prevent that. So it's a difficult situation, but what she did provide me and send me was the FBI bulletin explaining the consequences if you present a fake document. And I don't know if that should be disseminated or not, but I wanted to put it out there, and anybody who wants to see it, I think I sent a copy of what I received from Jill to Jordana. And maybe nothing comes of it, but her suggestion was we ask our restaurants and nightclubs and employers to post that bulletin so people understand the consequences of presenting fake evidence of vaccination. I'm throwing that out for conversation because I'm not qualified to have an opinion on it at this point. That's all I had on my round robin. But if anybody else has something else they want to chime in, we've got a little bit of time left. Boy, oh boy, it's such a quiet crowd here. Do I have you all on mute, or is it we all exhausted? Nobody has anything to say?
Well,
Okay, then.
I think because we did the best thing we could have first thing in the meeting. So nothing can top the decision we made about Jordana. So
Great, thank you. And to summarize, I'm going to summarize this in my position as chair, that we have consensus. So I just want to make sure everyone understands we have consensus that that we enthusiastically appoint Jordana to the position of Director of Public Health, because for the last very difficult 8 or 9 months, she was interim director. And previous to that, she was in the trenches working in public health. And so she's been here all along, and her qualifications are amazing, having looked through all the resume and had the interview with Jordana. I can say that we're all enthusiastic about this, and we're excited to go forward. And I look forward to seeing what happens next with public health under Jordana's direction. And I think the board would agree with that. Okay, then do I need a motion? I can't remember. Do I need a motion to adjourn this meeting? If that's where we are.
That we adjourn the meeting.
Okay, I've got a motion from Krista and a second from Dr. Kurt. Any other further discussion? Seeing none, I am going to get us out of here early. Shocking, isn't it? All in favor? All right, thank you all. I appreciate the meeting. Thanks for taking the time. Jordana, thank you for running the gauntlet, and the best of all outcomes has happened. So I'll see you all at the next meeting, and you'll hear from us when that'll be.
Thanks, Greg. Have a good day,
Thank
everybody.
you.
Bye, Jordana. Thank you.
Bye-bye.